Hello everyone, I'm Dr. Aditya. I'm a consultant in arthroscopy, sports injuries and shoulder surgery at Dr. Aditya Hospital. So we'll be discussing about the ACL injuries of the knee joint. So you might have heard that somebody has torn his ACL and is undergoing a surgery for that, or some athlete you might be aware of who has had an ACL injury and is undergoing rehab and so on and so forth. So what is this ACL? So if you look at your knee joint, so here it is. So there is this bone above called the femur and this bone below called the tibia. In between the bones is this structure called the ACL or the anterior cruciate ligament, which provides stability to the knee joint. It prevents the front to back movement of the knee. In addition to the ACL, there are ligaments on the inside as well as outside the knee joint which give it stability. So typically in pivoting sports, where your knee twists or you are suddenly changing direction, there can be an injury to the anterior cruciate ligament or the ACL. So typically when somebody is playing football or there is a tackle from the side or somebody is dancing and the knee suddenly gives way, that's the typical mechanism of an ACL injury. So you don't need to be involved in a very high velocity accident or something like that to actually tear your ACL. It's more about how the force is transmitted across your knee joint that determines whether you end up having a knee ligament injury or not. Now, when we look at the treatment, so treatment essentially depends on the age of the individual as well as the activity level of the individual and if there are any associated injuries. So, when there is an acute injury, the primary treatment consists of rest, icing the knee, wearing a brace around the knee. Typically, if you have had a knee injury, the knee swells up, that means that there has been some injury inside the knee joint. So immediately ice it, take rest, brace it, and you should visit a sports orthopedic doctor. So an MRI is generally done to assess whether there is an injury to the ligament in the knee joint, which will decide on the further course of treatment. Long-term treatment essentially depends on the age of the individual, the activity level, what vocation they are into, whether they are playing sports or not. So generally, in individuals above the age of 45, who are low demand individuals who are not playing sports or maybe doing jogging once in a while, then the treatment of choice is essentially physiotherapy, activity modification, that they are told to avoid any activities which can lead to pivoting in the knee joint, like playing badminton or tennis or football or stuff like that. They can obviously do jogging and swimming, cycling, these things. However, in younger individuals, let's say between the age of 12 to 40, typically if there is an ACL injury, it can lead to associated injuries in the knee joint. It can also have coexisting injuries associated with it. So in addition to the ACL, there is this structure in the knee joint called the meniscus. So it acts as a shock absorber in the knee joint and transmits the load across the knee joint. So if in addition to an ACL injury, a meniscus injury is there, then surgery is required. If the individual is young, athletic, competitive, then surgery is required. If these ACL injuries are associated with other ligament injuries or if they are associated with cartilage injuries, in these scenarios, surgical treatment is required. So essentially the surgery consists of a keyhole surgery or an arthroscopy. So in that, through very small cuts around your knee joint about the size of your fingernail, the knee is accessed with devices and an endoscope. So we visualize the damage inside the knee joint and correct it. So essentially to reconstruct your ACL or the anterior cruciate ligament, we take a graft from either one of these sources, which can be a bone patella tendon bone, it can be from your hamstrings, that is the muscles from the inner aspect of your knee joint, or one of the tendons from around your ankle. So we use that to reconstruct the ligament. Primary ACL repair, yes, it can be done if it's a avulsion injury, that is the ACL is come off with a piece of bone. ACL surgery, if there is no associated meniscus injury, the individual can immediately start putting weight on the knee, he can start walking. The mobilization is done with the help of a brace or with the help of a walker. Typically by 2 to 3 weeks, the brace and the walker are discontinued and the individual can start walking normally. There is a stage-wise rehabilitation after an ACL surgery. So there are certain exercises which you need to do from 1 to 3 weeks, 3 to 6 weeks, and so on and so forth. So typically the duration of rehabilitation lasts anywhere between 4 to 6 months depending on the individual's recovery and whether they want to resume any form of active sports or not. ACL surgery is one of the most common arthroscopic surgeries done across the world and has shown great results and has helped a number of athletes resume sports, return back to their activities and fulfill their aspirations. Here we have treated more than 4,000 individuals who have undergone various forms of surgery with us and have successfully recovered and have returned to their activities. Thank you. For more information, subscribe and like the channel.